So we haven't provided a COVID update in a few months, so I thought I'd take the opportunity today. We are happy to share that things have improved. We've only had 2 new cases in the past 24 hours and 2 new cases the 24 hours prior to that, so that's hopeful news to us. So far, we have had total cases in Navajo County reported 15,749, and 7,075 of those have been worked by our public health nursing team. We have currently monitored and released 6,713 households from isolation. So considering that there are multiple people in each of those households, and we currently have 17 households on isolation. So just because we have 2 new cases, we also sometimes isolate their direct contacts, so we can have multiple households from 1 case isolating. We have had 1,704 cases in Navajo County requiring hospitalization, and 504 of those cases are non-tribal. We've had 542 deaths to date. 188 of those have been non-tribal cases, and off reservation 692 cases that have impacted a school, so a student or staff member of a school. We to date have reported 54,388 vaccinations given in Navajo County. We have seen a drastic decline in the interest of vaccination over the past several months. So we're still pleading with our community to consider being revaccinated. We fear that one of the things is people think that if they've had COVID, that immunity carries them long-term or for a lifetime, and that is not the case. Natural immunity from COVID infection carries you 90 days, and after that 90 days, your immunity starts to wane. And so what we are seeing now is we're starting to see reinfections of people who were infected with COVID during our last spike. So to date, we've only had 20 reinfections, but 17 of those have been since April. So that kind of gives you an idea. So we're just asking people who have been infected in the past with COVID to consider if vaccination is a good option for them. To date, in Navajo County, we've identified 571 variant strains. That's the different variants combined. There are multiple strains, multiple variants. And they're not testing every sample for a variant strain. It's a random sampling, and to sequence that out because only certain labs are able to provide that testing. So to have identified 571 off of random sampling says we have a lot more of it circulating than we realize. And those variant strains are more infectious to children, and they cause more severity and disease process in children. And we are seeing that as well. So since January, prior to January in the outbreak, 5% or less of our overall cases were in children. In January, 13% of our cases were in children. In February, 17%. March was 26%. April was 23%. So that kind of gives you an idea of what we're seeing. We're also have had one of our school districts that was directly linked to a small cluster outbreak at the end of the school year, and there were variant strains identified in some of those samples. So there are now vaccines available for children. The Pfizer product has been approved for individuals 12 and older. So we ask you to consider if that's a good option for your adolescent children, and to consider being vaccinated and encourage that. And hopefully the Moderna product is just around the bend from being approved by the FDA, and it will be approved for children 6 and older. So we're hoping that will be a helpful tool. Otherwise, we do have it on our radar that we could experience another spike in the fall when school resumes and the weather changes and people start congregating more closely together. We're hopeful that won't happen, but we're prepared just in case. For our public health picture and perspective, we have mostly moved fully back into our recovery mode. We are performing all public health services as normal other than our walk-in shot clinics. We still haven't resumed that, but we're looking at resuming that service in July. So that is our public health COVID update for you today.